I'm about to show you exactly how to mechanically lower your blood pressure readings using simple biological triggers that most standard advice overlooks. If you have been relying solely on medication, but your numbers are still fluctuating, or if you are worried about the long-term silent damage to your kidneys and vision, the specific protocols I am going to share are the missing piece of the puzzle. I'm about to reveal the exact lifestyle levers that force your blood vessels to relax, not through magic, but through proven physiology that works even if you have battled hypertension for decades. I remember a patient named Robert, a 72-year-old retired engineer who came to me with a folder full of blood pressure logs that made absolutely no sense to him. He was doing everything his previous doctor told him, taking his pills, walking occasionally, and trying to eat less salt. But his morning readings were still dangerously high. He was frustrated because he felt fine physically, but he knew that high blood pressure is often called the silent killer for a reason. He was terrified that he was slowly damaging his internal organs without even realizing it until it would be too late. We didn't change his medication immediately. Instead, we looked at how he was measuring his pressure and what he was eating to fuel his blood vessels. Within weeks of applying the methods I will list here, his numbers stabilized. It is possible that your current routine is missing these specific adjustments, leaving your vessels stiffer than they need to be. Before we begin, a critical disclaimer. The information I'm sharing today is strictly for educational purposes and should not be considered medical advice. I am not your personal physician and cannot provide individualized medical guidance through this video. 1. Implement the resting protocol accurately before you ever wrap the cuff around your arm to measure your blood pressure. This is the single most important step because treating a number that is artificially high due to stress, poor posture, or incorrect timing can lead to over-medication and dangerous side effects like dizziness or falls. Most seniors are inadvertently creating a false high reading at home, which leads their doctors to increase dosages unnecessarily. You must separate your true blood pressure from the pressure caused by the activity of your day. This distinction matters because blood pressure is not a static number. It is a dynamic response to your environment and body position. When you measure incorrectly, you are capturing the stress on your system, not your baseline health. I recall a patient named Martha, a 68-year-old grandmother who was convinced her medication had stopped working because her home readings were consistently over 150 systolic. She was taking her blood pressure while sitting on the edge of her soft sofa with her feet dangling and the TV news playing in the background. She was anxious and rushing to get the chore done. Once we corrected her posture and environment, her true reading was actually 135, proving she did not need a higher dose of medication, but rather a better measurement habit. The mechanism here is related to hydrostatic pressure and the sympathetic nervous system. If your back is not supported, your core muscles remain engaged to hold you upright, which slightly raises your heart rate and pressure. If your feet are not flat on the floor, or if your legs are crossed, you compress the major veins returning blood to the heart, which artificially raises the pressure reading. If your arm is hanging down rather than supported at heart level, gravity adds weight to the column of blood, skewing the numbers higher. By eliminating these variables, you get a reading that reflects the stiffness of your arteries, not the tension in your muscles. To do this correctly, sit in a sturdy chair with a hard back, not a soft sofa. Place both feet flat on the floor. Do not cross your legs or ankles. Rest your arm on a table so that the cuff is at the same level as your heart. Most importantly, sit in this position for 5 full minutes before you press the start button. Do not talk, do not look at your phone, and do not watch television. Just breathe. This 5-minute window allows your cardiovascular system to return to its baseline state. It is crucial to ensure the cuff size is correct for your arm. A cuff that is too small will always give a falsely high reading. This simple protocol ensures you and your doctor are making decisions based on reality, not error. Consume specific nitrate-rich vegetables daily to chemically induce vasodilation in your arteries. While general advice says to eat your vegetables for blood pressure control, we need to be much more specific about the chemical composition of the plant. We are looking for dietary nitrates, which your body converts into nitric oxide, a powerful signaling molecule that tells the smooth muscles lining your blood vessels to relax and widen. This widening lowers the pressure within the system immediately, much like widening a garden hose reduces the pressure of the water rushing through it. This approach transforms food into a functional tool for vascular health. I vividly remember James, a 74-year-old gentleman who despised the idea of dieting and refused to eat bland salads. He was struggling with stubborn hypertension that wouldn't budge below 145/90. We didn't overhaul his entire life. We just added a concentrated source of nitrates to his lunch. He started drinking a small glass of beet juice mixed with a little apple for flavor. Within 3 hours of his first glass, his systolic pressure dropped by several points, and over a month, his baseline shifted down significantly. He realized that this wasn't about deprivation. It was about adding a specific tool to his regimen. The science behind this is robust and focuses on the enterosalivary circulation. When you eat nitrate-rich foods like beets, arugula, rocket, spinach, or celery, the nitrates are absorbed and then secreted into your saliva. Bacteria on your tongue convert these nitrates into nitrites, which are then swallowed and converted into nitric oxide in the stomach. This gas diffuses into the arterial walls and causes them to dilate. A recent study highlighted that older adults who consumed nitrate-rich beet juice experienced a noticeable reduction in systolic blood pressure, comparable to the effects of some single medications. To get this benefit, you can either drink about 250 ml, 1 cup of beet juice daily, or eat a large bowl of arugula or spinach. If you choose to eat the greens, chew them thoroughly. Because the conversion happens in the mouth, it is vital that you do not use strong antiseptic mouthwash, as this kills the beneficial bacteria on your tongue needed for the conversion process. Without these bacteria, the nitrates cannot become nitric oxide, and you lose the blood pressure benefit. Practice isometric hand grip exercises 3 times a week to lower your resting blood pressure through nervous system regulation. This is often the most surprising recommendation for seniors because it requires very little movement and no cardiovascular strain, yet it is incredibly effective. Isometric exercise involves contracting a muscle without changing its length, essentially squeezing something and holding it. This specific type of contraction sends a signal to your brain to modulate the autonomic nervous system, resulting in a lasting reduction in resting blood pressure. This is particularly useful for those with limited mobility. I think of Eleanor, an 81-year-old patient who suffered from severe knee osteoarthritis. She could not walk long distances or jog, which made standard exercise advice frustrating and impossible for her. Her blood pressure was climbing because she was becoming sedentary due to pain. We introduced isometric hand grip training, which she could do while sitting in her armchair watching her favorite evening show. She felt empowered because she finally had a physical lever she could pull to help her heart, despite her bad knees. The physiological mechanism involves shear stress. When you squeeze and hold, you temporarily restrict blood flow to the muscles in your hand and forearm. When you release the squeeze, blood rushes back in, creating a surge of flow that shears against the vessel walls. This shear stress stimulates the endothelial lining of the blood vessels to release even more nitric oxide and creates a training effect that lowers the sympathetic fight or flight tone of your nervous system. Over weeks, this resets your body's pressure thermostat to a lower level. To perform this, use a programmable hand grip device or a simple stress ball that offers significant resistance. Squeeze the object with one hand at about 30% of your maximum effort. It should feel difficult but sustainable. Hold this squeeze for 2 minutes. Rest for 2 minutes. Then switch hands and repeat. Do this for a total of 4 squeezes, 2 per hand, per session, 3 times a week. It takes less than 15 minutes and requires no sweating or heavy breathing. Be careful not to hold your breath while squeezing, as this can temporarily spike your blood pressure. Breathe rhythmically and calmly throughout the 2-minute hold. This training method provides a unique pathway to lower pressure for those who cannot perform high-intensity aerobics. Drink 3 cups of hibiscus tea daily to mimic the action of common blood pressure medications known as ACE inhibitors. Hibiscus sabdariffa is not just a pleasant beverage, it is a potent herbal medicine containing bioactive compounds called anthocyanins and polyphenols. These compounds have been shown in clinical trials to inhibit the angiotensin-converting enzyme, ACE, which is the same mechanism targeted by drugs like lisinopril. By inhibiting this enzyme, the tea prevents the blood vessels from constricting, keeping them open and relaxed. This creates a consistent, gentle, downward pressure on your readings. I recall David, a 65-year-old who loved his coffee but was told by his cardiologist to cut back on caffeine due to his jitters and spikes in pressure. He felt deprived and missed the ritual of a warm drink. We swapped his afternoon coffee for a deep red, tart hibiscus tea. He enjoyed the flavor, which is similar to cranberry, and after 6 weeks, he noticed his evening measurements were consistently lower than they had been in years. It gave him a sense of control and a new, healthy ritual. The effectiveness of hibiscus relies on consistency and concentration. You cannot simply dip a tea bag for 10 seconds and expect medicinal results. The compounds need to be extracted fully into the water. The deep red color is a visual indicator of the potency. The darker the tea, the higher the concentration of the beneficial anthocyanins. It works by influencing the kidneys to excrete excess sodium and by directly relaxing the smooth muscle of the arterial wall. To use this effectively, steep high-quality hibiscus flowers or tea bags in boiling water for at least 5 to 7 minutes. Cover the cup while steeping to keep the volatile oils from escaping. Drink 3 cups spaced throughout the day, perhaps one with breakfast, one with lunch, and one in the late afternoon. It is naturally caffeine-free, so it won't disrupt your sleep. Adopt a potassium-first strategy rather than simply focusing on eliminating salt from every meal. While reducing sodium is the standard advice given to almost everyone, it often leads to bland, unappetizing food that seniors struggle to stick with long-term. The missing half of the equation is potassium, a mineral that works in direct opposition to sodium to lower blood pressure. Think of your cells as having a pump mechanism. Sodium pulls fluid in, raising pressure, while potassium pumps fluid out and relaxes the vessel walls. If you only cut salt but remain low in potassium, your body struggles to release the excess fluid it is holding. By aggressively increasing your potassium intake through whole foods, you can often buffer the effects of moderate salt consumption and see a natural drop in your numbers. This biological balance is often more powerful than restriction alone. I remember Margaret, a 76-year-old who loved to cook and found the low-sodium diet to be depressing and isolating. She felt she couldn't eat with her family because her food had to be prepared separately. Her blood pressure remained borderline high because the stress of the diet was counteracting the benefits. We shifted her focus entirely. Instead of counting milligrams of sodium, we counted servings of potassium. She started adding half an avocado to her breakfast and a baked potato to her dinner. Within 2 months, her systolic pressure dropped by 8 points, not because she suffered through tasteless meals, but because she gave her kidneys the tool they needed to flush out the sodium naturally. The mechanism relies on the sodium-potassium pump in your kidneys. When potassium levels are high, your kidneys become much more efficient at excreting sodium through urine. This lowers the total volume of blood in your system, which mechanically lowers the pressure required to pump it. Furthermore, potassium has a direct relaxing effect on the smooth muscle cells of the arteries. It effectively softens the pipes, making them more compliant to the pulse of blood coming from the heart. To implement this, aim to include high-potassium foods in at least 2 meals a day. A medium baked potato, with the skin, has more potassium than a banana. Cooked spinach, white beans, sweet potatoes, and avocados are also excellent sources. Aim for about 3,500 to 4,700 milligrams of potassium daily from food sources. Do not rely on supplements for this, as concentrated potassium pills can be dangerous and disturb heart rhythm. The slow release from food is exactly what your body handles best. Practice resonant frequency breathing for 10 minutes daily to mechanically synchronize your heart rate with your breath. This is different from normal relaxation or meditation. It is a specific pacing of breath, usually around 6 breaths per minute, that triggers the baroreflex. Your body has pressure sensors called baroreceptors in your neck and chest. When you breathe at this specific slow rate, you maximize the sensitivity of these sensors, teaching your body to dampen blood pressure spikes more effectively. It turns a chaotic heart rhythm into a smooth, coherent wave that reduces the strain on your arterial walls immediately. This technique serves as an immediate brake pedal for your cardiovascular system. I recall Thomas, a 63-year-old accountant who would get tension headaches in the afternoon that coincided with blood pressure spikes of 160/95. He felt out of control and would often panic, which only drove the numbers higher. We taught him to step away from his desk and breathe at a 6-second cycle for just 10 minutes. He found that by the end of the session, his headache would often dissipate, and his pressure would drop by 10 to 15 points. It gave him a tool to manage the acute stress of his day without needing an extra pill. The physiology behind this is the modulation of heart rate variability, HRV. When you inhale, your heart rate naturally speeds up slightly. When you exhale, it slows down. By extending the exhale to match a specific rhythm, you amplify this slowing effect, stimulating the vagus nerve. This nerve acts as the primary connector between your brain and your heart's relaxation center. Regular practice actually reshapes the autonomic nervous system's baseline, making you less reactive to stress over time. To do this, sit comfortably and breathe in through your nose for a count of 4 seconds, and then out through your mouth or nose for a count of 6 seconds. This totals 10 seconds per breath, or exactly 6 breaths per minute. You do not need to be exact to the millisecond. The key is that the exhale is longer than the inhale and the pace is slow and rhythmic. Do this for 10 minutes once or twice a day. There are even free smartphone apps that provide a visual pacer to help you follow this rhythm effortlessly. Avoid forcing the air out or straining your lungs. The breath should be soft and silent. If you feel lightheaded, return to normal breathing for a minute before trying again. This habit creates a biological safety signal that lowers pressure instantly. Prioritize deep sleep optimization and screen yourself for sleep apnea, even if you don't think you snore loudly. Many seniors treat sleep as a luxury or accept poor sleep as a normal part of aging, but biologically, sleep is when your blood pressure should dip by 10 to 20%. If your pressure does not drop at night, a condition called non-dipping, your cardiovascular system is under 24-hour strain, which dramatically increases the risk of stroke. Often, the cause is mild airway obstruction that prevents deep oxygenation, keeping the body in a low-level state of panic all night long. Addressing this nocturnal stress is often the breakthrough for resistant hypertension. I think of Susan, a 71-year-old who was taking 3 different medications, yet her morning blood pressure remained stubbornly high. She lived alone and didn't realize she was gasping for air intermittently throughout the night. She woke up tired but assumed it was just her age. Once we arranged a simple home sleep study, we found she had moderate apnea. By adjusting her sleeping position and using a simple oral appliance to keep her jaw forward, her nighttime oxygen levels stabilized. Within 3 weeks, her morning blood pressure readings dropped into the normal range for the first time in a decade. The mechanism is driven by cortisol and adrenaline. If your airway collapses even partially while you sleep, your oxygen levels drop. Your brain senses this suffocation and shoots a jolt of adrenaline into your system to wake you up slightly to breathe. This adrenaline spike constricts your blood vessels exactly when they should be relaxing. If this happens dozens of times an hour, you are essentially running a marathon in your sleep, keeping your blood pressure sky high all night. To optimize this, try sleeping on your side rather than your back, as back sleeping allows gravity to pull the tongue backward, blocking the airway. You can use a specific pillow or even sew a tennis ball into the back of your pajama shirt to prevent rolling over. Keep your bedroom cool, around 65 degrees Celsius, 18 degrees Celsius, and ensure it is completely dark. If you wake up frequently to urinate or wake up with a dry mouth or headache, ask your doctor for a home sleep test. Be cautious with sedative medications or alcohol before bed, as these relax the throat muscles further and can actually worsen apnea and blood pressure. Prioritizing airway health during sleep is a long-term lever that protects your heart when you are not conscious to do so yourself. Your blood pressure is not a fixed destiny. It is a dynamic response to the signals you send your body. By correcting your measurement technique, adding nitrates and potassium, training your nervous system with grip and breath, and securing your sleep, you are mechanically and chemically telling your arteries to relax. If you know someone over 50 who could benefit from this, share this video, and subscribe for more simple health tips.